Hello everyone and welcome to week number 2. This week we are going to be focusing on minor surgery and infection control. So with that means that we are focusing on only 2 chapters this week, going to be chapter 34 and chapter 42. So let's go ahead and get started. We are going to look at each of those chapters a little bit more in depth. So this week we're going to start with chapter 34, which is focusing mostly on infection control. Now, infection control is the process of reducing exposure to pathogens to prevent the spread of diseases. Pathogens are disease-producing organisms, and they are found everywhere, including inanimate objects and our human bodies. As a medical assistant, you need to be aware of how easy it is to really spread pathogens from one host to another. For this reason, we need to follow a term called asepsis. Asepsis means being in the state of being free from germs, infection, and any other form of microbiology life. And there are 2 types of asepsis that we're going to look at. The first is called medical, and the second is called surgical. Medical asepsis is what we call the clean technique. Washing your hands, making sure that you're wearing the correct protective equipment. All of those things fall under medical asepsis, or the clean technique. But surgical asepsis, that means sterile. So that means that we are going to kill all microorganisms or any sort of protozoa from before it enters the human body. We're going to eradicate it. And we use a process called sterilization in order for that to happen. Now, microorganisms are organisms that are so small they can only be seen with the aid of a microscope. Okay? But not all microorganisms cause diseases. But those that do, as I've said a couple of times now, are what we call pathogens. And there are 4 main types of microorganisms. We have bacteria, which can either be aerobic or anaerobic. Aerobic needs air. Anaerobic can live without oxygen. There's fungi, protozoa, and viruses. Now, these grow in one of 2 ways. And like I kind of talked about, either it's aerobic or anaerobic. Aerobic requires oxygen to live. Anaerobic does not. Now, all of these microorganisms need food, moisture, and a darkness to really grow and grow in the way that they should. Now, most of the time, we can grow bacteria on what we call an agar plate. And an agar plate is actually what's going to give it that food and nutrients that it needs, and then the incubator will give it that kind of heat and moisture that it needs to grow. So now that we really understand microorganisms, we need to understand how they're really spread. And microorganisms are spread through what we call the chain of infection. And with the chain of infection, there are 5 links in this chain. The first is what we call the reservoir host. Now, this is where the chain begins and is where the microorganism typically is either in a human or an animal. The second link is called the portal of exit. And the portal of exit is how a pathogen really gets spread from one host to another. It's any sort of opening that it can leave the body or the infected host. So the ways that they can get out include our respiratory tract, urinary tract, reproductive tract, or any open wound. Third link is what we call the means of transmission. And this is really how the organism got out. And this can either be in indirect contact or direct contact. Step 4 is the portal of entry, and that's really how your pathogen gets into the new host. And just like it got out of a host, that's the same way it can get into a host, okay? And the last link is what we call the susceptible host. And this is someone who is now able or unable to really kind of fight off those new infections. So they now become that infected agent, which then starts the chain over again with your reservoir host, your portal of exit, means of transmission, portal of entry, susceptible host, and so forth. It's just kind of a repeating cycle. Now, once you actually have that infection, what we then go through is called the stages of an infection. And there are 6 specific stages in total. First one is invasion, and this is where the pathogen enters the body through the portal of entry. Second is multiplication, so then that pathogen gets in and it starts reproducing itself. Third is your incubation period, and this may vary from several days to several months or even several years. During this time, the disease is developing, but really no symptoms will appear. So you can have this pathogen, you can be sick, but we'll never know it yet. Stage 4 is what we call the prodromal period. So it's when your first mild signs and symptoms start to appear. This is really the most contagious stage out of all of them. After that, you have your acute period, where your signs and symptoms are very evident and they're the most severe. And finally, you have that last stage, which is your recovery period, where your signs and symptoms are really starting to subside. All right, so that's chapter 34 kind of in a nutshell. Let's move on to chapter 42. And chapter 42 is talking about assisting in minor surgeries. Now, medical assistants may perform many duties related to minor surgery, but there's some before surgery techniques and after surgery. Before surgery, you're responsible for completing insurance forms, obtaining an informed consent from the patient, meeting with the patient, and answering any questions that they may have that are within your scope of practice to answer. After the surgery, however, you're then able to provide post-op instructions, including any wound care that is needed per doctor orders. You're also then going to be responsible for sanitizing, disinfecting, and sterilizing the instruments used within that surgery. So let's take a closer look at each of those. So when we first start talking about this, we need to talk about the principles of surgical asepsis, which, if you remember, is the sterile technique. And it's used when sterility of supplies and the immediate environment are required, specifically in things such as surgical procedures or any surgical incision or invasion of the body. It's also necessary during any sort of invasive procedures. This can even be things such as administering injections, making a surgical incision, or working with an open wound. And there are some guidelines or rules that you need to follow in order to make sure that you're obtaining that sterile field. You'll need to perform a sterile scrub with sterile gloving, opening a sterile package and making sure that we're using things that are sterile, and working with sterile instruments. So let's go ahead and talk about those topics. Now, surgical instruments are generally classified based on their use. That's either cutting, dissecting, grasping, clamping, dilating, probing, visualizing, or suturing. Specific instruments are used in specific specialties. So make sure that you know what you're using when you're using it. And when you're trying to identify an instrument, you want to ask yourself the questions that you see here on your PowerPoint. That will help you to determine if it's going to be useful or not for you to use. Now, when you set up a sterile tray, what you want to do is really make sure that when you're transferring them, you're using transfer forceps to place the instruments, not just dropping them on a sterile field. So this is kind of a good setup for a surgical assistant. What you're looking at here is on one side you have an actual surgical procedure. On the other side we have a sterile tray setup. A good scrub assistant will anticipate the needs of their physician. They will also use care when they're handling instruments. And when you're handing instruments to a physician, you always want to place them firmly in the physician's hand. You don't want to just kind of slack off and hand it. It's got to be a firm transfer. Use your care when you're making sure that an injury doesn't occur. And account for all materials and instruments used during a procedure. You don't want to leave anything in a patient's body after you close them up, because that's what actually causes severe infections, and it technically will come back to the surgical assistant because they did not make sure that everything was out or accounted for after the procedure. All right, guys. So assignments for this week. You have one discussion post, which is talking about the exposure to bloodborne pathogens. Your initial discussion post, again, will be due Tuesday, April 11th by midnight, and you need to reply to at least one classmate no later than Saturday, April 15th. Now, if you do respond to me as the instructor, that's awesome. I appreciate it. I really do like the communication. But I want to make sure that you are communicating with one another, not just me. So again, have to reply to a classmate in order to receive the grade. You cannot just reply to me as the instructor. But I do encourage you to have that communication with me as well. You have one course project written assignment this week, and it's looking at the hepatitis B vaccine information sheet, and you're doing a summary. So this will be due no later than Sunday, April 16th by midnight. And please make sure that you are checking out the rubric that I've posted in the online shell under Module 2, so you know what questions need to be answered and addressed, so that way there's no confusion. Lastly, you do have a quiz again this week. This week it's on personal safety. It will have 20 questions, and you have a 45-minute time limit. There is either multiple choice or true-false questions, and this will be due no later than Sunday, April 16th by midnight. All right, guys, that is all I have for you for Module 2. If you have any questions, comments, or concerns, please make sure that you are reaching out to me either via course messaging or my phone that is on the course homepage. Reach out to me as soon as possible if you do have questions so that I can help you get to a conclusion or the best answer before due dates, because you don't want to be waiting until Sunday at 10 o'clock at night to do your work. Please make sure that if you do have those questions, you reach out to me as soon as possible. I hope you all have a great week 2, and keep moving forward, guys. Bye-bye.